America needs universal health care to aid us through a terrorist attack. The current swine flu problems underscore just why universal health care must be instituted without further delay. There are many deadly viruses, but perhaps the most feared and apparently available to terrorists is the smallpox virus. A few years ago, the Bush administration stated there was enough smallpox vaccine to inoculate all Americans. Should an outbreak be confirmed, vaccine would be shipped to each state and the entire population vaccinated within 10 days. The prospect of vaccinating large numbers of people at central locations in a very tight time frame is not a pleasant picture. The problem is compounded by the fact that there are now more than 50 million Americans without health insurance. As the economy has declined and workers have lost their jobs, the number of uninsured has continued to grow. Many of the uninsured receive medical treatment only when there is an emergency. No one knows where they are or their state of health. There are no medical records. In an emergency, physicians and healthcare workers will have their hands full with their regular patients. They are unlikely to see those outside the system on a timely basis. If the uninsured do not show up for a vaccination, in many cases no one would know. Even if they get the vaccine, some people, as we have seen with H1N1, will have an adverse reaction to an inoculation and require medical care. This means the uninsured are not only at risk to themselves, but also a risk to the general public. If every American had a primary care physician, the process would be much safer and easier. The doctor would know from his records whether or not the patient was at risk from the vaccine and could recommend appropriate action. Within the last few years, we have been confronted with threats of salmonella, from peanut butter, spinach, tomatoes, lettuce, peppers, and pistachios. The evidence is clearer than ever. The real threat to our security comes not from a suitcase-sized atomic bomb, but from bacteria, chemicals, or viruses, whether spread intentionally or not. There are now more reasons than ever to enact universal health insurance. We should not put this off any longer. I can't imagine any patriotic American opposing such a plan. To do so simply gives aid to those who would hurt our country. The only way to adequately prepare to defend all America is to provide universal health coverage so no American is left behind. Surely a compassionate nation will not let uninsured Americans die in the streets. America needs universal health care now.